Welcome to Coronavirus The Rundown. I'm Chris Stewart. Each day, we showcase the ways communities are taking on coronavirus. We also break down the major headlines, and today, a drug supply warning. The only drug approved to treat coronavirus is on short supply. Doctors with Health and Human Services say the agency has enough remdesivir to get through the end of June, but that's it. Gilead Sciences makes the drug. It's working on the next batch, but hasn't said when it'll be ready to go out. The government says it's working with Gilead on supply chain issues that could delay production. Lockdown is over in New York City after 78 days. It's now in phase 1 of its reopening plan, though protesters have brought massive crowds together in the streets for the last couple weeks. Under phase 1, some non-essential workers can go back to work. Retail stores can do curbside or in-store pickup, but salons, offices, and indoor seating at bars and restaurants won't reopen until phase 2. The reopening of Broadway shows, museums, and gatherings is still a ways off. New research says restrictions and closures prevented at least 60 million coronavirus cases in the U.S. A team at UC Berkeley published the study. It says cases would be 14 times higher without any intervention. Researchers found a global benefit, too, saying restrictions prevented 530 million cases in the U.S., China, South Korea, Italy, Iran, and France. Now, summer vacations will look different this year and maybe for years to come. Alicia Nieves shows us people are now turning to RVs.
The RV industry, like every other sector of the travel industry, took a hit in business at the start of the coronavirus pandemic.
April was down probably 30-35%.
In Colorado, the Loveland RV Resort was no exception.
For every reservation we were getting a couple of cancellations.
But about a month later,
the reservations are up quite a bit. If you've been in the office, you can see that the reservation clerks are very busy.
Vacationers started rebooking road trips as soon as states started to reopen.
You just got to get some form of normalcy back, and yet be safe, and this is one of the only ways we know how to do it.
RV resorts, parks, and rentals are seeing a bounce back, and a strong one at that.
We're now up over 1,000% from where we were in early April.
John Gray is the CEO of RV Share, a company that rents RVs to vacationers and a company that has seen one of the most dramatic increases in RV rentals.
There's a premium on keeping your distance. There's a premium on driving to where you're going to go instead of flying, because people are afraid to get on airplanes right now. So we thought those things benefited our business, but we didn't realize it would benefit it as much as it has. I mean, it's been truly amazing.
The RV industry is one of the only sectors of travel and leisure seeing such a strong rebound. And until the threat of COVID-19 is behind us, industry experts expect continued high demand.
It's clear that this summer is a moment for the RV industry, for drive-to travel, and for people kind of experiencing travel in a different way.
If somebody wants to go camping, they should make their reservations now, at least 60 days in advance for this year and even next year. Major resorts
start at March to make your reservations for the summer.
Because we are filling up. And, I suspect by July 4th, we're going to be very full.
I'm Alicia Nieves reporting.
Alicia, thank you. Now, the future of college sports is still up in the air, and while it is unclear whether we'll see football in the fall, there's a different kind of game really unaffected by the pandemic. We're talking about esports.
But for them, they can still compete, they can still practice, they can still play, which you can't really be said for any other sport.
Now, this situation, some think, could be a change and a chance for esports to be put on a higher pedestal. Others say, though, not so fast, because there just may not be enough time to boost college esports programs.
As far as new programs coming up, that takes time to build. And so I think that they're going to steer towards the club direction, and then potentially in fall of 2021 or spring of 2020, or the spring 2021, I guess, would be when maybe new programs would start to pop up.
Experts at Next College Student Athletes say this would be the time to ask for funding to go to esports programs. Campuses without a varsity team likely need to begin by boosting esports clubs. Esports do seem to be already heading into a positive direction with more people tuning in to watch during the pandemic. Now, there's new evidence coronavirus may have appeared in China before researchers originally thought. Experts at Harvard Medical School are looking at traffic around major hospitals in Wuhan, China. It appears there were dramatic spikes in late summer of 2019 into the early fall. Experts tell ABC News the traffic coincided with internet searches in China for certain symptoms. Now, researchers say they don't know for sure if this means coronavirus was present at the time. Technology could help businesses disinfect even after coronavirus is gone. Sloan Dickey shows us the device a Colorado company created.
In a flash,
over a 15-minute period of time, kills everything.
Hotels could be up and running once again.
We can say with absolute certainty that we've done the absolute best to kill any remaining virus.
It's kind of futuristic, actually, with a little blast from the past.
One of the Puro lights we decided to name Alice after the housekeeper from the Brady Bunch.
Alice is a disinfecting light.
Designed to disinfect, hospitals, ambulances, things like that. We're the first to deploy this in the hospitality industry.
Made by Puro Lighting, a company based out of Littleton, the flash from this device does more than light up a room.
And this is where the xenon pulse technology comes from here.
According to Puro, it kills 99.9% of viruses and bacteria. Puro was originally designed for hospital disinfecting, but if a blast of light can disinfect under an operating table, it can get under a sofa, too.
Blast of light will get the carpet and the curtains underneath the chairs, the topical areas of the chairs that you can see.
Breckenridge Grand Vacations in Summit County was the first hotel group to purchase the Puro lights in mass. And managers say it's key to bringing vacationers back.
I think it's important that the traveling public know that there's an option for them that can provide levels of disinfection that they're not used to.
Now that the state of Colorado and many other destinations are slowly opening up,
I think the UV light or some kind of standard protocols like that, we're going to come to expect that in 2 or 5 years.
Something like this may light the way for hotels in the future.
Now, there is a debate about whether healthcare workers should get hazard pay, how much that would increase paychecks, and who might end up paying for the boost. And the new strategies experts are laying out for how students can start going back to school to learn.
Sandwiches. Get rallies delivered.
With all 50 states at least partially reopened, one question is, how much job growth will we see? Now, in South Carolina, one of the first states to reopen, some businesses are rehiring. Maya Rodriguez returned there to see what small business owners say is the solution to rebounding from the pandemic shutdown.
Nearly 2 months after a coronavirus lockdown, the changes are both subtle and obvious at the bookstore Main Street Reads.
We have our plastic shield up now. We have hand sanitizer all over the store. We are actually requiring people to wear a mask inside.
We first met owner Shari Stock in April, just after her bookstore reopened to customers following the lockdown. At the time, she was alone at the store, her handful of employees furloughed. But now, they're back.
I help manage the store, make sure it stays clean and tidy as people go through.
I've learned to identify people by their masks.
So what made all the rehiring possible? The bookstore relied on the Paycheck Protection Program, that federal loan program that helped pay for employees' salaries.
It's a loan that can be forgiven as long as those employees are kept on the payroll.
I would be here by myself if it weren't for that. It's just going straight to them. We just want to make sure that they're here and that they're here for the customers.
For Emma June Wood, it's made a huge difference financially.
I help support my family at home. So being out of work, even for the short period that I was, caused a lot of anxiety.
But coming back to work goes beyond income for Hannah Rose Summers.
Actually, the first day I came back, I almost started crying because I was so happy just to be back here. It's psychologically, it's just immensely important to me.
Shari Stock says she's grateful the federal small business loan is helping her hold on to her employees. But she adds, with business at the bookstore down 50%, there's always always room for more help.
We're not looking to make a score out of this situation. There's a lot of different groups that need help too, and like we keep saying, we're all in this together, so wherever it's most needed. But do they continue to need to funnel that into the communities? I think so.
Congress could potentially take up another stimulus bill later this summer, and small businesses may once again be part of it. In the meantime,
we have a saying here, today's readers are tomorrow's leaders. So, yeah.
leaders that the bookstore may need to turn to in the future. In Somerville, South Carolina, I'm Maya Rodriguez reporting.
My thank you. And as the country continues to rebound, experts are laying out how kids can go back to in-person schooling.
We highlight the need for, in the reopening, to focus on the children who are most at risk and prioritize those with the greatest needs.
Education and public health experts at Johns Hopkins University outlined a 6-point plan based on safety, health, and academic needs. The plan focuses on kids with remote learning barriers first, including special education students and those who rely on schools for food support.
We're seeing reports from children who are saying that they aren't learning as much, that they don't have access to people to help them, that they don't feel as comfortable learning.
Now, the experts argue that districts with limited resources should bring back the youngest students first. They struggle the most with virtual learning. They also say districts need to have a virtual backup plan ready just in case cases start to rise again. Now, families who may not feel comfortable going back or have special high-risk circumstances like, say, a grandmother taking care of a young child, they should also have virtual options. And there are other concerns beyond educational needs.
The kids get a lot of social and emotional development. They get their relationship with the teacher, which is extremely important, for them and their development, their friends. And so cutting kids off from that over a critical period of their lives for an extended period is really detrimental to them.
More than 20 million children rely on school breakfast or lunch for food. Surveys indicate 1 in 5 mothers report their children younger than 12 years old are going hungry. Another key role that schools play, teachers and other officials recognize about 1 in 5 cases of possible child abuse. Now, with COVID-19 cases still rising in some states, some are fighting for healthcare workers to get hazard pay. Kai Beach reports some say they should be paid extra like soldiers going into war.
Try not to get emotional. I'm already starting to tear up.
Deborah Torres has made a career out of helping others. This registered nurse works at a hospital in Southern California. When the coronavirus hit her community, Torres decided to move into a hotel to keep her family safe. Now others are fighting for people like Torres working on the front lines, trying to get them paid more.
Something to recognize them much as a soldier going into battle.
Rulon Stacy is a former hospital CEO turned college health administrator. He wants hazard pay for all healthcare workers.
I know these people, and I know that they would step in and take the bullet for you or me or anybody if it's who they are.
Stacy doesn't have an exact amount in mind, but he does believe the money would have to come from the federal government.
My argument is that it comes in the next phase of the CARES Act, which is the 4th tranche that they're debating right now.
According to experts, registered nurses make a mean annual wage of about $77,000. Across the country, other industries like some grocery store chains and fast food restaurants have already increased workers' hourly rates. Now, Stacy says those healthcare workers that stepped in during this crisis deserve more recognition and extra money.
It's the right thing to do, and it will ensure our future when things like this happen.
If I don't get the hazard pay and I have a patient with COVID, I'm still going to care for that patient no matter what.
Torres says she's signed up to care for sick people. And while extra money would be nice, what she really wants is better protection for her industry.
The hazard pay is just like a cherry on top and be very nice to have. But my priority is to make sure I have my equipment.
I'm Kai Beach reporting.
Struggles people with hearing loss face are only being increased by coronavirus-related isolation, the new device that's helping people with their hearing and safety. Next.
Kroger, fresh for everyone.
Welcome back. Many of us have a grandparent or maybe a parent who has a difficult time hearing. It's a problem being magnified as we rely on calls to stay in touch. But Chris Conti shows us how a new device is helping people hear while also keeping patients safe.
It inflates sideways then backwards out of your ear.
Sometimes it's the things we can't see that we rely on the most.
So the whole outside of your ear I've scanned, and now I'm getting all the way down your canal. Jane's ear is shaped just like this.
For Jane Money, that thing is her hearing.
And this is the shape of your canal.
In the middle of a pandemic, we found Jane here at Tobias and Petit Hearing in Boston. This 65-year-old choral instructor has suffered from hearing loss for decades.
There's the outside, going down your ear canal.
You have to be quite brave, I think, to go and say, excuse me, but I am not hearing very well, because this is what you depend on for your livelihood.
So the balloon's almost fully inflated.
In the past, Dr. Brian Flygore would have made a putty mold of Jane's ear to fit her with a hearing aid. But in the age of COVID, that's changing.
I'm going to start the actual scan now.
With the help of a Lantos 3D scanner, Dr. Flygore can now scan his patient's ears. Instantly, he gets a computer file that can be sent to a hearing aid manufacturer. He's realized that these saved digital files mean fewer patient visits when there's a problem.
If they had any issues with their hearing aid not staying put, if they had any issues with their ear mold not being comfortable, instead of them having to come back in again, this scanning system allows me to just fix it remotely.
That could be key for doctors across the country. Physicians are trying to find ways to increase telehealth practices to keep patients from getting the virus.
It's imperative for us because we're only able to have one patient in our office at a time. And so having less reason for people to have to come in means that I have less physical traffic in my office.
As for Jane Money, being able to hear her students on Zoom calls and her family is more important now than ever.
I live in a family, and people I would like to hear what they say. And it's even more important because they're home all the time.
That's something we understand very clearly about this time during the COVID-19 pandemic, is that our mental health has really taken a downturn because of isolation. People with hearing loss always feel that isolation. This helps me to limit that sense of emotional isolation.
Something that during this pandemic is worth hearing loud and clear.
That is your ear, only in a digital file.
I'm Chris Conti reporting. Now, another added bonus to having that digital file of your inner ear. Hearing impaired patients can go online and order custom fitted earbuds to pair with their cell phone. They run about $125. A group of friends is helping others with art. The surprise bags they're leaving out for people to grab.
Sandwiches. Get rallies delivered.
Welcome back. We like to end the rundown with the stories that remind us of the good that is happening right now. And it's an art therapist in Oklahoma we're looking at today, paying it forward with what you're looking at here, a giving tree. Yeah, it's a metal Christmas tree that she's placed outside her art studio. Every Thursday and Saturday, Linda Reynolds and her friends place bags on that tree, and each bag is a surprise and contains items to make arts and crafts. Reynolds says that tapping into our creative side, especially during a pandemic, helps our brains.
When people are engaged in expressive art making, that our brains relax. We can be more open-minded, childlike, playful, curious, interested.
Now, many of the items come from the thrift store. Reynolds says regardless of where they're from, they can still be used to make art. And that's all the time we have today for Coronavirus The Rundown. We'll see you next time. I'm Chris Stewart. Thanks for joining us.